Good morning, good afternoon, good evening, everyone from around the world. Welcome to the report launch of the citizen-led air quality monitoring project of GAIA in collaboration with our partners in Indonesia, WALHI Jawa Timur, in Nigeria, the Green Knowledge Foundation, and in the Philippines, Negros Oriental. Today, we are going to launch the findings of our report in these three different sites, along with the documentary that goes along with it to highlight the impacts and the stories on the ground. My name is Brex Arevalo, Climate and Anti-Incineration Campaigner of GAIA. And let me introduce to you our project, why we are doing this, and let's get right into it. First, I would like to introduce GAIA. We are a global network of 1,000 grassroots groups across the world. Through policy finance, narrative shifts, GAIA seeks to create enabling conditions for systemic support of zero waste systems. We are envisioning a just and zero waste world centered around respect for ecological limits, community rights, where waste burning and dumping are replaced with people-powered solutions. We target specifically waste incinerators, largely because of the number of toxic pollutants that are emitted by all kinds of incinerators, regardless of technology, regardless of whether they are more advanced or more expensive. They are known to release a number of different deadly chemicals: particulate matter, carbon monoxide, toxic metals, toxic ash in wastewater, and even dioxins, perhaps the most toxic chemical pollutant known to science. Throughout this, in envisioning this report, we noted a number of problems related to testing emissions from incinerators. The first is that traditional periodic testing of dioxins alone, the most deadly chemical pollutant, is typically underestimated by about 460 to 1,290 times. Second, even the most modern continuous monitoring of dioxins is very expensive, costing about $30,000 to $90,000 per year based on estimates from Taiwan. And third, waste burning companies and governmental bodies fail to properly monitor and disclose emissions. Now, this means that typically when we have communities that are hosting waste incinerators, they're typically not given access to any of the emissions reports and are usually excluded from any sort of public consultations around the site. Now, this led us to the advent of mobile monitors. Now, we envision here that with the help of citizens, we will be able to monitor the data, the emissions, the pollutants coming from all of these waste incinerators. Because incinerator testing is expensive, and because we typically do not have access to any information, we thought, why don't we do all this testing ourselves? So with our partners in Green Knowledge Foundation in Kopijo in Nigeria, with WALHI East Java in Surabaya, Indonesia, and with War on Waste Negros Oriental in Dumaguete in the Philippines, we worked with dozens of volunteers going around the waste incinerators and monitoring the emissions with these little devices. Now, what is this little device? This little device is the AirBeam 3. It's a palm-sized air monitor developed by Habitat Map based in the USA. And it measures particulate matter, temperature, and relative humidity in the air. Of particulate note is that In this study, we are measuring particulate matter. It can take measurements per second. It has features such as GPS in the real-time clock. It is weather resistant, has a battery life of up to 17 hours, connects with a mobile application, and with its removable data storage, you can access data via a computer. And what is amazing about this technology is that it is very accurate. It has been tested by several of the authorities in the USA, and it costs only $199 per device. Now, particulate matter, which is what we are measuring, is a mix of solid and liquid particles in the air that can be hazardous to human health when breathed. These typically cannot be seen by the naked eye. They are microscopic, and incinerators are known to emit significant amounts of these. Now, there are other sources of particulate matter to note, such as open burning and vehicular traffic. Now, to be presented by our presenters are findings focusing on PM2.5. Now, you might see there on the screen PM2.5 underneath the human hair diagram. It is many times smaller than a typical human hair. Now to introduce our presenters. Joining us is first and foremost Dr. Jorge Emmanuel, former Chief Technical Advisor for Global Environmental Fund Projects of the United Nations Development Program in New York. He joins us as the Chief Technical Advisor for this project, and is also an adjunct professor at Silliman University. Dr. Jorge will be presenting findings from Dumaguete in the Philippines, followed by Mr. Tubongbanua, also part of the technical team, and is a lecturer at Negros State University in Negros Oriental. Presenting findings from Nigeria is Ms. Doun, policy researcher from GAIA, from the GAIA Global Team. Joining us later on in the panel is the convener of WALHI Negros Oriental and the president of the board of GAIA Asia Pacific, Ms. Merci Ferrer, and also Mr. Wahyu Styawan, director of WALHI East Java. Now, to kick us off for the presentation of key findings, we first present to you a brief trailer of the documentary presenting these findings.
Sao nato kung especially kung may mga kalamidad, ang mga basura nato diri karon sa Kandaway, it will come back to us people here in Dumaguete.
Mana terus biasanya dilempar ke mana?
Kalau sampahnya ya pastinya dari kayak TP, terus.
See the smoke. You cannot even see back. See it oh. This is what we are facing. See us. May God help us there. Oh.
Around the world, communities have long suffered from the burden of waste incinerators placed in their backyards. But in 2024 and 2025, residents in the Philippines, Indonesia, and Nigeria did something powerful. They gathered the data to tell their story. This is Clearing the Air, the truth behind waste incineration.
To present findings from the Philippines and give a brief overview of the research, we please call into the floor Dr. Jorge Emmanuel.
Yes, good day to everyone. I'm all glad you're here for this webinar. What I will be presenting will be the results of Dumaguete City here in the Philippines. I'd like to mention the other two members of the technical team who worked with me here. Tubongbanua will be presenting shortly, and also Michael Bisario with Negros Oriental State University. I'm with Silliman University, which is another institution in the same city. So let me begin. Yes, let me begin by telling you a little bit about this machine. The machine, which is called a pyrolysis gasification machine, was installed beginning around 2021, and it began operation in March 2022. Those of us who've been working with these types of technologies have been requesting the city and the government agencies involved for copies of the stack test emissions, because we knew of the many pollutants that come from these types of technologies. And in one forum, we found out that no tests have been done, and at least to this date, no test results have ever been released. The picture you see at the bottom is the entrance to this facility. Most of us have not been able to enter the facility. In fact, we were told by a number of city councilors that they themselves have not been allowed to go inside the facility. And a picture of the pyrolysis gasification machine is shown on the right. Now, when we found out about the cost of this technology, we were very suspicious, because we knew, even though it was a lot of money for the Philippines, compared to incinerators around the world, the cost was very low. And so we suspected it wouldn't have the air pollution control devices needed to keep down the pollutants. And as it turns out, we were able to, or somebody was able to take a video of the pyrolysis incinerator in operation, and you see it on the right. And you can see the huge amounts of dark smoke coming out. The smoke is visible even from aerial images found on Google Earth, as you can see with the arrow points. Now, this technology operates 9 hours a day, 5 days a week. And as we've begun to share this information to the local communities, we found out that many of them did not even know that it existed in this plant, which people are not allowed to go in. Our concern was especially for the pollutants that you can't see with the naked eye. And so what we did is we took advantage, thanks to GAIA and the funders, for providing us with 7 of these Airbeam 3 devices. We were able to get 17 community volunteers from the 3 surrounding communities, the 3 communities surrounding the pyrolysis incinerator. And we asked them to wear these devices around their necks. And so they did this from 8 in the morning to 6 in the evening, typically. And each of the volunteers did it for 9 to 10 days each. This monitoring took place in different batches from October 2024 till February 2025. I'd like to point out that one of the requirements for the volunteers was they had to fill up a daily time activity log. This is very important. We asked them to make a note every day, typically where they were, but more importantly, we gave them a list of all the known particulate matter sources that you'd find. For example, cigarette smoking releases particulate matter. So does open burning of waste. Cooking in a wood stove also releases it. And being in an area with a lot of traffic also releases particulate matter. So they listed all of this down. And this is important because it allowed us to eliminate the readings that were because of other sources of particulate matter. So it allowed us to do an analysis of the particulate matter readings that we could attribute solely to this pyrolysis incinerator. So before I tell you the results, you need to know what the standards are. There is a World Health Organization health-based standard called the Air Quality Guideline, or AQG. There are actually two standards. One is a measurement for an average annual reading, which of course we couldn't do. We couldn't do these tests for a whole year. But they also gave a short-term concentration standard. And the standard was listed as a short-term concentration average for a 24-hour. Now, as I pointed out, we could only measure outside from our volunteers during the day. So we only typically had about 10 hours of reading. And so we looked at other references, including the US Agency for Toxic Substances and Disease Registry, which pointed out that since health outcomes are possible for exposures less than 24 hours, the ATSDR said the WHO guidelines are applicable and can be used as screening values for exposures less than 24 hours, even as short as 1 hour. So that means that our 10 hours of measurements were still a valid comparison to the AQG. So what is the AQG for particulate matter 2.5? Basically, it says that the average reading should not exceed 15 micrograms per cubic meter, 15 micrograms per cubic meter. But if you do, a person should not be exposed to this for more than 4 days in 1 year. So these are the numbers you have to remember: 15 micrograms per cubic meter, not more than 4 days in 1 year. So let me show you an example of some of the readings that we downloaded from the AirBeam 3. So this gives an example of 2 different days, 2 different volunteers. And as you can see, the values go from 0 to 1,000 micrograms per cubic meter. You can see, for example, in the bottom right, this person was measuring almost 1,000 micrograms per cubic meter at about, it looks like it's about 10:47 in the morning. So, so the question is, how does this compare with the WHO guidelines? So this is where the WHO guideline belongs in this graph. It's way at the bottom, 15 micrograms. So the important thing to note is, when you average these values, do you get a value that's below that line? And now I will give you the results for the average reading in the case of the pyrolysis source. So this is what we found. If we did an average for all of the volunteers, because sometimes there might be 3 or 4 or 5 volunteers on a given day. So we took the average for all of those 5. And what you will notice here is that for 23 of the 27 days of monitoring, the WHO guidelines were exceeded. Remember, it's supposed to be, should it exceed 15? And it shouldn't, there should be more than 4 days in a year. And yet, for 23 days of the 27 days we're measuring, they were already beyond the WHO guidelines. So this is very disturbing for the surrounding community. What we also did is we looked at how it compares for the individual volunteers. So in the first table in the middle, you will notice that 16 of the 17 volunteers had their daily averages already exceeding the WHO guidelines. In other words, we took what's called the 99th percentile of the readings, as you're supposed to do, and we found that for all except one, they had exceeded the WHO guidelines. But even more disturbing, again, is the table on the right, which shows that for 11 of the 17, they already exceeded the 4 days, even though they were only measuring for typically 9 or 10 days. Out of those 9 or 10 days, more than 4 days was already exceeded, and some of the others were close to 4 days. Again, this is very, very disturbing. So what are the health effects of PM 2.5? We know that PM 2.5 is linked with acute bronchitis. It triggers severe asthma attacks, resulting in hospitalization. For mothers who are pregnant and exposed to PM 2.5, their children come out with low birth weights. During short-term exposures, you can even have heart attacks for people who already have existing comorbidities. You can have strokes and arrhythmias, irregular the beat of the heart. And for long-term exposures, we can have premature deaths due to cardiopulmonary disease and ischemic heart attacks, and premature deaths also due to lung cancer. So what we did is we took the US EPA's tool for determining, based on PM 2.5, whether you could say that the air in your area is good, moderate, unhealthy for sensitive people, or unhealthy for everyone. So we used the PM 2.5 data to then determine what the EPA calls the air quality index. And so when it is yellow, that means that people who are unusually sensitive, and these are typically people who already have heart disease, they would see a worsening of their conditions. If the day could be labeled as orange, that means for sensitive groups, and these include, again, people who already have cardiopulmonary diseases, and it often would also include very young children and elderly people. They would be at an increased risk of respiratory systems. And finally, if it's red, that means there's an increased risk of respiratory effects on everyone, the entire population. So if we look only at the particulate matter attributable to the pyrolysis incinerator, you would see that out of the number of days here, 27 days of measurements, 5 days were red, it was bad for everyone. 22 days was unhealthy, especially for sensitive people. Yellow was unhealthy for those who are especially sensitive, unusually sensitive, people who are already sick, for example. And we only had 3 days that could be considered as good days. So 88% of those days was unhealthy for some portion of the population. Now, as Brex had mentioned, unfortunately, there are many other pollutants coming out of incinerators, and all we measured were those for particulate matter, shown in red. We are unable to measure all the others because it's simply much too expensive. But I want to point out that all those others also have their different health impacts, including different types of cancers, effects of the nervous system, brain cancer, and so on. And this means that the people who are exposed, in fact, the data shows exposed to as far away as 5 kilometers, within a radius of 5 kilometers of these incinerators, are at risk to many of these health effects. And we have to remind people that this is the potential impact for those who live in the surrounding communities. Fortunately, we're able to at least measure one of them, and that measurement, particulate matter, already allows us to tell government agencies and so on that our people are exposed to higher risks of health impacts. And so the recommendations from our work are as follows. We're asking the City Council to pass a resolution for the immediate closure of the pyrolysis incinerator. We're asking them to monitor the health of waste workers at the plant and also of the residents in the surrounding areas, and to attend to their health needs. given the impact we know of particulate matter and, for that matter, the other pollutants coming from the incinerator. And finally, we also recognize that we need to look at solutions. And so we're calling on the city to implement zero-waste solutions to all the communities. We have a few communities that are already doing it. Why not expand it to all the communities in our city to be able to protect our the health and well-being of our people? Thank you very much.
Thank you very much, Dr. Jorge. Up next, to present the findings from Surabaya in Indonesia. May we please welcome Mr. Al Tubongbanua.
Good day. My name is Al Tubongbanua, and I will be presenting the air quality monitoring findings of Surabaya, Indonesia. Okay. A little background on the Benue waste to energy plant. This is a gasification technology process up to 1,500 tons of waste per day. Its operating hours are around 7 a.m. to 6 p.m. This is based on the monitoring by WALHI East Java. The facility has not publicly disclosed operating hours. And the population, it affects around 11,684 residents of Somberijo Urban Village in Pakal District, where the plant is located. The community is concerned with pollution, including black smoke, wastewater, and an unpleasant odor is affecting residents as near as 1,000 meters away from the facility. Now, moving on to the findings of the report, we can see that the maximum daily average of PM2.5 concentration levels range from 20 to 113 micrograms per cubic meter across all 14 monitors. And the PM2.5 concentration levels exceed WHO AQG for all 31 days of monitoring. The PM2.5 concentration levels of 113 micrograms per cubic meter is 8 times above the guidelines of the World Health Organization, which is the 15 micrograms per cubic meter. Looking at the air quality index set by the WHO, during the 31 days of monitoring of the PM2.5 concentrations, 7 days were unhealthy for all the population. 7 days were also unhealthy for sensitive groups of the population, and 17 days were unhealthy for highly sensitive individuals. It is noted here that there are no good days among the 31 days of monitoring. Now, the recommendations by WALHI East Java. First is to permanently shut down the Benue waste to energy plant. Next is to conduct an independent and transparent environmental audit and emission test. Third is to examine and address the health impacts on surrounding residents. Next is to promote zero waste policy, source separation, recycling, and composting. And of course, to provide financial and technical support to affected communities. That is the findings and recommendations of the study in Surabaya, Indonesia.
Thank you very much, Mr. Al. Now, next up, to show findings from Nigeria, may we please welcome Ms. Doun.
Thank you, Brex. I hope everyone can hear me okay. I'm gonna share my screen. Okay, so on behalf of Green Knowledge Foundation, I am presenting the results of the monitoring that we did in Ogiju, Nigeria. and I'll be brief. So let's go to the facility profile page. So this is a tire recycling plant, as they claim, but we know that the word recycling is a little bit questionable here. The technology type is said to be pyrolysis, but local residents have
excuse me, Doun,
witnessed.
we can't see the slide.
Oh, I see. It's because I'm using two monitors. What about now?
Still not there.
What about okay, let me try again. Sorry about that. Yes. Working?
Yes, perfect. Thank you.
Great. Okay. So as I was saying, even though the facility is claiming to be a pyrolysis facility, local residents have witnessed that there's open burning of tires happening in the facility. So it's very questionable. It began operation in 2013. And the community concern, the main community concern is the bad air pollution, which you can see in the mini documentary. And when I watched the documentary, I was like, I wasn't able to breathe normally because it's just too much pollution. And I invite you all to check out the mini documentary if you haven't done so. And this is the finding, the same graph that Al presented. And you need to look at the center, Ogijo, which shows that the maximum daily average throughout the 23 days of monitoring period was 82 microgram per cubic meter. And the pattern of exceedance of the WHO guideline was consistent across all three mobile monitors and also throughout the full period of monitoring, which was for 23 days. And then this is the air quality index calendar for Ogijo. And you can count the numbers yourself here. It was unhealthy for 6 days, unhealthy for sensitive groups for 12 days, and moderate for 5 days. And you can't really see a green day out of these 23 days of monitoring. And one thing that was worth noting in Ogijo is the cumulative impact, because the facility was located in the industrial cluster. So we weren't really able to specify the tire so-called recycling facility as the main source of pollution. But what was clear to us is that the industrial cluster itself was a huge source of pollution, because when they had an accident and when they had to shut down for a couple of days in March this year, you can see the red dots, which is the normal regular operation period where you see high levels of PM pollution. And then compared to that, the yellow line is the time when the industrial cluster was shut down. So you see a clear difference showing the contribution of the industrial cluster. So in this kind of case where your waste facility is not the only source of pollution, then it's even more important to have the stack emission testing to properly check and track the pollutants coming out of each facility. So all the more reasons why we need better regulation and monitoring. And I'm gonna let Rex to go over the recommendations across the 3 monitoring sites now. Thank you.
Thank you, Doun. To summarize the recommendations from the 3 monitoring sites in Dumaguete, Philippines, Ogijo, Nigeria, and Surabaya, Indonesia, it is first of all to shut down the immediate shutdown of these plants, which, as this study has shown, emits tremendous amounts of particulate matter. is connected with a host of different community concerns, such as visible smoke, bad smells, and of course, leaking pollutants to the immediate environment. Number two is to conduct health analysis, health studies among the affected residents and also the waste workers who are involved and are in direct contact with these facilities, or for example, with in the case of Binowo, with the Binowo landfill next to where the facility is located, or even in the materials recovery facility, which is where the pyrolysis plant is located in Dumaguete. These waste workers, we would like to highlight, are some of them are working in the plant, some of them are working around the plant, but we hope that we have shown clearly how their exposure to the pollutants coming from these plants, these sites, are causing significant impacts on their health. Now, thirdly, across all three sites, we would like to mention that all of them are calling for zero waste, the implementation of zero waste policies, where we hope for better source segregation, better reduction of waste at source, and also with that, the empowerment of communities, which is one of the objectives and one of the overall outcomes that we hope we are able to attain from this citizen-led study. Now, with that, I would like to thank again our three speakers who presented the key findings. Thank you, Dr. Jorge. Thank you, Mr. Al. And thank you, Ms. Doun Moon. Now, we move on for the next 15 minutes to a panel discussion where we would like to invite to our panel Ms. Merci, Mr. Wahyu Styawan, and again, please join us again here, Ms. Doun Moon. Now, I would like to ask the first question to Ms. Merci. Now, Ms. Merci, as highlighted by Dr. Jorge, zero waste work has already been happening in Dumaguete City, in several barangays, several local governments in the area. However, this has been disturbed, affected by the recommendation for the pyrolysis plant by the Department of Environment and Natural Resources. Now, how do you think this incinerator was installed in the first place, even though zero waste was already being implemented? And how do you think the zero waste work in these barangays and in the wider Dumaguete area is being affected by this pyrolysis plant?
Okay, thank you. Good afternoon to everyone. Salamat sore, maayong hapon sa tanan. Thank you for the question. We started the work in Dumaguete City, the Zero Waste Cities work, in 2018, and the incinerator was bought in 2021, and it operated in 2022. It really impacted and disturbed the zero waste efforts of the NGO, the War on Waste, and the barangays that really said yes to the work. Mainly because the policy of the local government of Dumaguete says that there is already an incinerator, thus zero waste work wasn't really recognized. So, but the perseverance of the first 4 or 5 barangays really continued, and the work is still ongoing. There is actually data that really showed that the waste diversion was really more than 50% waste diversion in all the first four barangays really impacted on their waste issues or waste problems. So yes, it is the Department of Environment, the Philippine Department of Environment and Natural Resources, especially the region 7 where we belong, that recommended the pyrolysis, and therefore you cannot. People will say, well, this is recommended by no less than the policy making, body. So what's wrong with it? But nevertheless, now the problem in Dumaguete is that the wastes are piling up because even incinerating the waste from the 30, no, we have 30, total of 30 communities, local communities, or what we call barangays, is not even helping. So the waste is piling up, and it's already a new dump site that we are seeing in the area where the so-called central MRF is located, and where the pyrolysis is also operating. Is that
Thank you very much, Ms. Merci. And to follow up very quickly,
Yeah.
what are your thoughts on how citizen-led air quality monitoring like this can influence both local and national policy?
Okay. I believe we in the zero waste and no to incineration movements, together with our allies, together with the media, need to bring the health issues or the impacts to health to a higher level of presentation and discussion. The narrative should go beyond to just an income generation or economics or financial sound endeavor by our governments. People's health should be in the frontline argument, specifically pollutant levels and its impacts to health and the vulnerable sectors of our community. So I think we really need to elevate the discussion and presentation and giving more data that health should be on the front line when we discuss all of these things. For me, this also means that we got to mobilize resources for more citizen science-based studies and actions, invest in more air quality monitoring in the different areas, because this is just the pioneering work that we're doing in the 3 cities. So, and if perhaps we can get or mobilize finances for biomonitoring of dioxin and heavy metals, that would be great, because this is what we need. Elevate the impacts to the community's health. I think this is what we need at this point in time. Thank you.
Thank you very much, Ms. Merci. We move now to Mr. Wahyu Styawan from Indonesia.
Yes.
The question I'd like to ask is, in Indonesia, the Indonesian government has really integrated waste to energy incineration into its policy frameworks, both for waste and also for climate change. Now, your organization, WALHI's Java, and the wider WALHI network across the country has documented over the years how these are promoted with little to no meaningful consultation. Now we wonder, what were some of the testimonies or recorded narrative logs of the monitoring volunteers in the community? And what new opportunities for policy engagement do the air quality findings have for Surabaya and for WALHI and for community?
Okay, thank you, Brex. During our East Java community led air monitoring around Benowo Waste to Energy incinerator, resident and volunteer share a first-hand account to reveal a troubling pattern of environmental harm and institutional neglect. Men describe bicycle discomfort such as dizziness, couching, and eye irritation occurring when passing near the incinerator, especially uh, during its operating hours. One volunteer reported a strong stinging smell and sudden dizziness when walking past to the smokestack. And the resident living in Benowo and the nearby neighborhood expressed a concern about worsening air quality in the early morning and evening. These periods often coincided with recurring symptoms among children, such as persistent coughing and breathing difficulties. Local mother share how her child, who had never suffered from a respiratory issue before, now frequently coughs in the morning. This invisible nature, particularly small enough to enter the lungs and bloodstream, has made a source daily anxiety, especially for parent and caretaker of vulnerable family member. And alongside the house concern, many residents expressed a frustration at being excluded from the decision making process. Community members reported they were never properly informed or consulted about the construction or operation of the waste to energy facility. Requests for the access for environmental document like environmental impact assessment were denied, reinforcing a sense of powerlessness. As one elderly resident put in, we never consulted. One day the smokestack was just there. Yet, despite the exclusion, the monitoring campaign sparked a sense of empowerment. Volunteers who participated in the mobile monitoring felt that, for the first time, they had concrete scientific proof what they had long suspected. The air they breathe is not safe. Real-time and visual the handle device gave them the confidence to speak up, advocate for transparency, and demand policy change. This our experience in Benoa, Surabaya. And the air quality finding in Surabaya provided by local communities with WALHI, and we want to the monitoring result empowerment communities to demand more participatory environmental in the government with a real-time and specially distributed data gathered by residents themselves, while he advocate for citizen science and community monitoring to be formally recognized within a local and national environmental oversight framework. This could include lobbying for regulatory change that mandate third-party or community-led quality monitoring around high-rise industrial facilities, especially in densely populated areas. And the campaign creates new avenue for regional and international collaboration by linking the Surabaya case to similar experience in the place like the Philippines and Nigeria, while he can build transnational pressure against waste to energy expansion and push for stronger pollution safeguard in multilateral agreement. And we can force the government to make evaluating the project and make the transparency of the data. I mean, this opportunity to us to link the advocacy to the government.
Thank you, Mr. Wahyu Styawan from WALHI in Indonesia. Now, we move to our last panel discussion question, and we would like to welcome again Ms. Doun Moon. Ms. Doun, perhaps the most alarming daily PM concentrations were in Ogijo in Nigeria. As you mentioned in the videos, black smoke is regularly emitted from the tire incinerator, which is also classified as a recycling facility. Now, in light of these air quality findings and your other work covering recycling globally, should incineration like this be considered as recycling?
Thanks, Brex. My short answer to that would be no. And the reason why is because, well, depending on how you define recycling, maybe the answer can be different. But to me, the essence of recycling is to recover materials so that the materials can serve for the similar or same function as the original material. And in the case of the tire so-called recycling facility, they are not turning tires into new tires, right? There's no recovery of the materials that can serve the same function or similar function. And also, they are not even doing the recycling right, because as I've said before, the local residents have witnessed that there was open burning happening in the facility, right? And also the concept of energy recovery is not recycling, because it doesn't put the recovered materials back into the circular loop, displacing the need for material production. So it doesn't contribute to the recovery of materials, and also it's not efficient enough. So oftentimes the energy recovery operations require external energy sources. So there's really no point in really doing that. Also considering that there's a huge amount of greenhouse gas emissions associated with those operations. So in short, my answer is no.
Thank you, Ms. Doun. And thank you to all of our panelists, Mr. Wahyu Styawan also, and Ms. Merci Ferrer. Now, at this point, we will have 15 minutes for an open forum. Thank you to those who have already pitched in their questions in the chat box. I can see that two of them asked by Anil and by Sipeng have already been answered in the chat box. Now, opening the floor, I see there is one question here for Dr. Jorge from an anonymous participant, and they say, and I quote, "The mayor of Manila in the Philippines is planning to announce a health emergency due to pollution brought by the garbage problem. The solution proposed is a waste-to-energy incinerator in the Smoky Mountain area. What advice would you give to the mayor?" Dr. Jorge?
Yes, thank you very much for this question. A few things. First of all, I would try to make the case to the mayor that putting in a waste-to-energy incinerator will make matters worse. The view that a lot of people take is that waste-to-energy incineration or incinerators in general take the waste and make it disappear. And I hope what this work is able to show that that is not in fact the case. These types of technologies take waste and they basically create a new poison that then gets spread into the air to expose even larger numbers of people. There are newer technologies, newer waste-to-energy technologies, where if you look at the stack, you won't see any of the black smoke that we see, for example, here in Dumaguete. But it's also important to note that many of the studies in Europe that have been using continuous dioxin monitoring, for example, and biomonitoring, which somebody had mentioned, shows that even the most advanced waste-to-energy incinerators in Europe, after only about a year or a few years of operation, are now seeing high levels of dioxins in eggs. This is what biomonitoring, an example of biomonitoring, dioxins in eggs that exceed the European safe limit for dioxins. So the solution is not really these high-tech gadgets. The solution is really how to change behavior, how to get the political will of governments to move towards to work towards zero waste, which is a more decentralized system, and it entails the engagement of communities, from segregation at source to recycling to composting, through all the things we need to do, including reduction and prevention of waste. The other thing I should also like to mention is that the Philippines does not have the capability today to do continuous dioxin monitoring, the very things that have been done in Europe to show that all of these high-tech waste-to-energy incinerators are actually causing major problems to their communities. So rather than promote an equipment that we as a country cannot even test to make sure that we're protecting our citizens, we should move for other ways that have been shown to really reduce waste and goes a long way towards solving the waste problem.
Thank you, Dr. Jorge. I'd like to move to Mr. Wahyu Styawan. Now, Isma Hanifa has asked whether WALHI has conducted a dissemination or any activities with the provincial government of East Java or a local government regarding this study. So basically, has any advocacy efforts been done with the government there in East Java, Mr. Wahyu?
Okay, thank you, Isma, for the question. And I can share our experience. We have conducted several activity. The first related to investigation of how the waste to energy is running, especially in our report. A closer look at PLTSA Benowo atau melihat lebih dekat PLTSA Benowo yang that's a publication in our website, and we try to share to the public with our network. We have invited for many times the government to focus group discussion and meet them in audience, but just meeting was no significant development. The peak was when we asked for the AMDAL or environmental impact assessment document. They refused and categorized it as copyright, and this is not and this is part of violate the regulation, especially in open information and environmental regulation. And for this and for our new monitoring for this result, we will immediately publish and create related activities such press conference, and we will try to reach out the government again. And the challenge in East Java is that the government is quite close to this issue, especially in Surabaya or the East Java province. So this is our obstacle. We face the close government and close participation in our experience, especially in this case. Thank you.
Have another question from Golly Ramos, both for Dr. Jorge and Miss Mercy. And I quote, thank you for presenting on the initiative. It is ironic that the data did not emanate from the public sector, but this is a great way to continue in mainstreaming awareness and action for implementation of the Clean Air Act, including holding those who are accountable for this project. Now, Golly Ramos is curious if public consultations were done by the Department of Environment and Natural Resources prior to implementation. Under the local government code and the EIS law, this is a mandatory requirement. Would either or both of you like to respond?
I'd like to start with that, answering. Hello, Golly. Thank you for your question. No, neither the DNR, the Department of Energy, Region 7, nor the city officials did consultations. And that's the very sad thing that happened in Dumaguete. The discussion was done during the pandemic, and it was vastly approved during the pandemic. Although Dr. Jorge was invited to give a his technical comment on the technology, but it was the city council who did the invitation, and his presentation was not given fully because of lack of time. So yes, they were all in violation of the policies that we had. There was no consultation at all. What we've heard from the communities, they signed a petition for another meeting, but it was used by the local government saying that they approve of the incinerator. So just to let you know that the communities around the Dumaguete pyrolysis is now allergic to sign petitions. So we will be looking at other creative means to get their buy in on this, because they will not sign any petitions because their signatures were used to say, the local government did consulted them by this kind of petition, but it is not the real situation. So in Dumaguete City.
Thank you, Ms. Mercy. Now, my next question is for Ms. Doun. Um, Ms. Doun, in your work with GAIA, have you been able to measure, Artia Sachdeva and asks, have you been able to measure the incremental PM 2.5 caused by WT incinerators anywhere else? And they mean not including other sources of emissions, such as industrial or transport-related emissions.
Sorry, Brex, can you please repeat the question again?
Yes, RT Sachdeva asks, have you been able to measure the incremental PM 2.5 caused by WTE that doesn't include industrial, transport, or other sorts of emissions?
Yes, so it kind of varies by the monitoring site depending on the local context and where the facility is located. I'm sure Dr. Jorge can explain this better, but in the case of Dumaguete, we were able to really attribute the PM 2.5 pollution to the specific pyrolysis unit because we were able to remove all the other measurements that are affected by the heavy traffic and smoking and cooking and other sources of pollution in that area. So it was very clear to us that the Dumaguete pyrolysis plant is the main source of pollution. And in other two cases, it varied because in Ogijo, it was located in the middle of an industrial cluster. So there are other multiple sources of PM 2.5 and other pollutants. So we weren't able to single that facility out. But as I said, we need to focus on the cumulative impacts in that kind of situation. And in Surabaya, the gasification unit in the waste to energy facility is the main industrial source in that area. But then there's also a highway. So we can't say that we really ruled out all the emissions from the highway entirely because it's very difficult to do so. But still, we were able to see the volunteers who were impacted by the emissions as they were passing by the incinerator. And there were some other details that we included in the report. So yeah, if any others wanna chime in, please feel free to do so.
Maybe I can just add, Brex. Yeah, the one way to be able to prove the amount of particulate matter, PM 2.5 in our case, coming from an incinerator, a pyrolyzer, whatever machine you have, is to do direct stack testing. And unfortunately, there are two problems. One is in Dumaguete, I know in Surabaya, and possibly also in Nigeria, we're not allowed to go inside the facility. We don't have the cooperation of the people who are operating the plant. And so that's one problem. Plus, of course, the tremendous costs somewhere in the neighborhood about $15,000 per test for some of these. So we cannot do that. So what we had to do is, as Doun mentioned, we used one system, which is to note whenever the volunteer was near the other sources of particulate matter, so we can actually eliminate them. It's also interesting that we did tests in clean areas where we could also see just the effects of, for example, waste burning, and we saw that it was significantly less, but we could eliminate those. The other thing that was done also is when you can compare the air quality when the incinerator is operating to when it's not operating, which is what was done in Nigeria. The other thing we did, and this is only possible under circumstances, but it worked well in Dumaguete, we actually put stationary monitors on different axes before upwind and downwind of the plant. And so we knew where the predominant wind direction was. We had an anemometer and a wind vane that was recording every few minutes. So we knew the speed of the wind. And so we selected those periods when the wind was blowing from upwind, our upwind monitor, stationary monitor, to our downwind monitor, and we compared the concentrations, and in every single case, the concentration was significantly increased, which showed that the PM 2.5 that we're measuring downwind was from the pyrolysis plant. So that's all I'll add.
Thank you, Dr. Jorge. And if I could ask one last question to you, Sipeng Wong asks, will there be any room for authorities or the companies to dispute the readings collected from this study?
I'll speak for Dumaguete. Our plan is, yesterday was our first launching and press conference, but as we announced to everybody, everyone will get a copy of our report, including the people operating it, including all of the major government officials, including the Department of Environment and Natural Resources, the government agency that actually recommended this technology to them. And so we assume that they'll get a chance to read it, and I'm hoping we'll have a chance to engage in a discussion with the government officials, especially on the implications of the report.
Thank you, Dr. Jorge. Now we have several more questions in the chat box, and we don't have enough time to go through all of them, but we hope we can get to them in a post email after this webinar. Now, I'd like to close with one final question addressed to Ms. Merci. This is from Christina Eloisa Baclig from the Philippine Daily Inquirer. And Christina says, President Marcos recently in the Philippines has recently announced a waste-to-energy project in partnership with Japan's Kanadevia Corporation for Metro Manila, and has repeatedly expressed support for WTE incineration as an income-generating solution. In light of this, how can the findings from this report, particularly on pollutant levels near waste-to-energy incinerators, inform or challenge the prevailing government narrative that waste-to-energy incineration is a clean and economically beneficial answer to waste and flooding problems? Ms. Merci?
Yeah, thank you for the question from the media. As I've said in my first presentation, I think we need to go beyond the economics or the income generation narrative that the government, like in this case, the Philippines, has been telling us. And it is a challenge for us in the movement, in the implementation of zero waste and no to incineration work, that we need to highlight health impacts. This is a clear case that we have done in Dumaguete City, the impacts of, to health via the citizen science monitoring that we did. And what I am hoping is that if this is the challenge that we have to have more of this kind of thing. And I think the other response to that is that we need to highlight this report, share this to the government, share this to Ferdinand Marcos if we need to meet with him. Coming from a small city, we have to face the executives that are working in the national and say that this is not what we need to do. Well, in fact, you need to support us and look into the health impacts of the community, especially the waste workers and the communities around. So I think it's both a challenge to us that are working on this on zero waste work, and also to really expedite our work and more information on the positive things when we do zero waste. So I think it's for GAIA and for all of us to really show that this is working, zero waste is working, and it is working, and really challenge our national government that this is not the way to go forward.
Thank you very much, Ms. Merci. And with that, we will close our open forum. Again, we thank you again for everyone who has asked a question in the chat box or has given a comment. We will try to get back to you in an email right after this webinar in case we didn't get to you. We would like to close this webinar with a quick summary. We have gone through the findings of our citizen-led air quality monitoring sites from Dumaguete, Philippines, from Surabaya, Indonesia, and Ogijo in Nigeria. In all three sites, we have reaffirmed what has already been known in science. What has already been known in science and what has already been felt by the communities who are living in or near these sites. And it is that these incinerators, big, small, old, or new, are in fact emitting significant amounts of pollutants such as particulate matter, dioxins, or others that are affecting people's health, that are affecting the environment. These pollutants can oftentimes be seen as black smoke, such as in the case of Nigeria, which is emitting gargantuan amounts. And I encourage everyone to look at YouTube videos. And it can also be not seen. As we have discussed over here, this study focused on particulate matter, which cannot be seen by the naked eye, but is nonetheless impacting the health of residents and impacting the health of workers and all others who are living in or near the area. Now, to note, we would like to mention that this report launch is just one of several steps in communicating findings of this report to the public. 2 weeks from now, on July 15, we will have a press conference in Surabaya, led by our partners in WALHI East Java, to launch their policy brief on this report. In Dumaguete in the Philippines, for the past 2 or 3 weeks, we have seen 3 or 4 different local events, such as a health forum, a forum with waste workers, and a press conference with the media in order to communicate this to a wider audience. And also in Nigeria, this evening at 11 p.m. Philippine time is the global launch for those living in a time zone friendlier to the Nigeria side, or to the Latin American or the North American side of the world. And we encourage everyone to join that also, which will also go into deeper depth on the Nigeria study specifically. And with that, we would like to thank all of our partners again, Negros Oriental, WALHI East Java, Green Knowledge Foundation, to our funder, Clean Air Fund, to the developer of the device, Habitat Map, based in the USA, and also to all our panelists, guests, and friends. This has been Brex Arevalo from GAIA. We thank you all. Good morning, good evening, good afternoon. Have a great day.
Thank you very much.
Thank you, everyone.
Thank you very much.